I'm Debbie Statler, Editor-in-Chief of Provider Magazine, and today we're here with Bill Charnetski, Executive Vice President, Health System Solutions and Government Affairs of PointClickCare, and Steve Holt, Vice President of Government Affairs for PointClickCare. Thank you for being with us today.
Great to be here, thanks.
Steve, let's start with you.
Sure.
Innovation in technology is critical in every industry, yet long-term care seems to be lagging a little bit behind. Why is that?
Yeah, so it really all starts with how our federal government has invested into the healthcare space. You go back to 2009, you look at the HITECH Act, they committed a little under $40 billion for the acute care setting to invest in technology and really the innovation to increase care coordination, care collaboration, talking with other providers in the ecosystem. And so you really saw a tremendous level of adoption where today it's 98% of certified EHR technology adoption. And then COVID comes along, and I think that showed a lot of light where there can be a lot of education done with our policymakers, our legislators, our regulators. And at PointClickCare, we're very active in those discussions, making sure that they understand what's going on in the communities with providers and residents. And then you see a lot of the other stakeholders getting involved, people like ACA, reports like the National Academy of Sciences that start to point the finger at there needs to be more technology adoption. And so I think we're at the point now where this education's occurring, legislators are listening, there's the new piece of legislation around veteran affairs and senior living, and so there's more and more attention being had. And so I think the time is ripe to strike and to continue that conversation.
And I'm guessing along with that education, funding is another critical piece. Where would funding for technology in long-term care make the biggest difference?
So there's lots of opportunities. I think probably encapsulated by seamless data integration. The system talks a lot about achieving quadruple aim, so improving population health, reducing the cost of delivering care, improving patient or resident satisfaction, and also improving the viability of providers. But you can't really get there unless you've got investment in interoperable technology, the integration of that technology, and educating staff. Once you do that, then you get yourself to a place where you're really able to improve outcomes and reduce the cost, and thereby creating value in the system. And holistically, you begin to include our sector, the long-term post-acute care sector, into the broader health ecosystem. And it's that interoperability, again, as I said, the seamless data integration, that creates the biggest opportunity for us.
Making that one puzzle piece fit with all the other pieces.
Right.
Well, we seem to be at an inflection point where more baby boomers are entering assisted living, long-term care, skilled nursing. How would implementing more health IT help? Steve?
Yeah, so really an integral part, and the question we have to ask ourselves with HIT and the best uses for it is how do we best benefit the patient and how do we best benefit the providers and the care teams. And so when you think about patients, that's increasing care coordination, care collaboration, offering greater visibility into care plans, both for the patient as well as their loved ones, and really improving transitions of care for whenever they leave or come back to the four walls where they reside. And then when you think about the clinical care teams, burnout's at an all-time high. Staffing is the biggest issue we hear when we talk with our partners. It's the biggest topic here. So how can we increase efficiencies for those care teams that they can do what they are loved and what they're committed to do is just providing that care at the bedside, having real-time insights as they're doing so, and really having less time worrying about administrative functions.
Absolutely. Well, innovative health IT solutions extend obviously beyond just electronic health records, and you've mentioned a couple of different things, but what other technologies would most help long-term care providers? Where are the areas that might get the most help from tech?
So again, opportunities are endless, right? We talk about EHR, but that really is the base. It might, a better way to think of it might be establishing a digital platform across the sector and one that has that seamless integration into the rest of the health ecosystem. So once that seamless integration and interpretation is critical, once you have that, then you're able to begin to apply the technologies to improve clinical outcomes, improve administrative efficiency, and ultimately really get to the heart of some of these things that Steve was talking about, like the staffing challenges, as well as, again, creating value in the system with improved outcomes at the same or lower cost point. And so when you look at the individual components, Once you have a system in place where you've got billing and census and finance in place, then you can start to look at broadening the administrative aspect, improving the clinical applications that are available, and make sure that they're seamlessly integrated with that digital platform we're talking about, and ultimately increase the efficiency to, again, to get at the staff overplay. But ultimately, you're looking at your ability to capture real-time data insights from the point of care. The opportunities beyond that range for everything from, maybe attaching to ancillary technologies, using different clinical applications. So ancillary technologies could be all sorts of different ideas from other companies. It's not a PointClickCare, dominated solution. Then, as far as improved clinical applications, there's things like skin and wound care, infection prevention and control, and different applications that get to the clinical outcomes. So at the end of the day, as I said, you've got improved administrative efficiency, so that goes to the heart of the staffing challenges, and improved clinical outcomes supported by real-time data insights from the point of care.
I like how you frame it as sort of, the foundation, and then once you have that interoperability foundation, you really can take it to many different levels.
Right, and the power of establishing that digital platform is each subsequent change is iterative, right? Like, we're not talking about a big technology infrastructure program. You got to rip the spine out and rebuild the program or anything like the application or the program or anything like that. It's software, right? So once you have the digital platform, each one of these things is iterative and much easier for the operator to create.
That's always key.
It's
easier
always important
for the operator. Well, how can providers help advocate for increased investment, incentives, education for health, IT, and long-term care? Where can they get involved?
Yeah, I think the easiest place to get involved is really with your national associations like ACA, as well as your state chapters, where a lot of healthcare policy gets done at the state level and trickles up, which is a little bit backwards, right? But that tends to be how that works. And so getting involved at that local level is huge. The big thing about advocacy and all of this work around development is it's about contribution, not attribution. We're not going to get this done individually, single-handedly, alone, right? So being able to all come together, form the community, and educate policymakers, legislators, regulators on what we're doing and how we're doing it, and how the providers are providing excellent care on a day-to-day basis is really important. And so it's just educating and delivering that message.
And echoing Mark Parkinson and lots of the state association CEOs, maybe the best thing that operators could do is have their local, state or federal representatives come to the site, come to see what it's like to run a skilled nursing facility or an assisted living or senior living facility, whatever it might be, but really have them come and experience that and see that it's not, there's a lot of, sometimes it's even quite negative press that comes that really are attacking the heroes at the front lines, which is what our folks and the operators are. And to get these people on site to really see what it's like when we take care of their loved ones could be really powerful.
Absolutely. I've heard from several different people how important that visit is and that firsthand experience for the legislator or regulator.
Oh, yeah.
Well, thank you for spending a few minutes with us
Thank
today.
you.
Appreciate it.
Thanks for having us.